Hepatitis A virus signs and symptoms. One early symptoms of hepatitis A infection can be mistaken for influenza, but some sufferers, especially children, exhibit no symptoms at all. Two symptoms typically appear 2 to 6 weeks, the incubation period, after the initial infection. 3. About 90% of children do not have symptoms. The time between infection and symptoms, in those who develop them, is between 2 and 6 weeks with an average of 28 days. The risk for symptomatic infection is directly related to age, with more than 80% of adults having symptoms compatible with acute viral hepatitis and the majority of children having either asymptomatic or unrecognized infections. 3. Symptoms usually last less than 2 months, although some people can be ill for as long as 6 months, fatigue, fever, nausea, appetite loss, jaundice, a yellowing of the skin or the whites of the eyes owing to hyperbilirubinemia. Bile is removed from the bloodstream and excreted in the urine, giving it a dark amber color. Diarrhea, light, or clay-colored faces, acolic faces. Abdominal discomfort. Extrahepatic manifestations. Joint pains. Red cell aplasia. Pancreatitis. Generalized lymphadenopathy are the possible extrahepatic manifestations. Kidney failure and pericarditis are very uncommon. If they occur, they show an acute onset and disappear upon resolution of the disease. Taxonomy. Hepativirus A is a species of virus in the order Picornavirales in the family Picornaviridae and is the type species of the genus Hepativirus. Humans and vertebrates serve as natural hosts. At least 13 additional species of the genus Hepativirus have now been identified. These species infect bats, rodents, hedgehogs, and shrews. Phylogenetic analysis suggests a rodent origin for hepatitis A genotypes. 1 serotype and 7 different genetic groups, 4 human and 3 simian, have been described. The human genotypes are numbered I, 3. 6 subtypes have been described, IA, IB, IIA, IIB, 3A, IIIB. The simian genotypes have been numbered 4, 6. A single isolate of genotype 7 isolated from a human has also been described. Genotype 3 has been isolated from both humans and owl monkeys. Most human isolates are of genotype I. Of the type I isolates, subtype IA accounts for the majority. The mutation rate in the genome has been estimated to be 1.73 to 9.76 times 10^4 nucleotide substitutions per site per year. The human strains appear to have diverged from the simian about 3,600 years ago. The mean age of genotypes 3 and 3A strains has been estimated to be 592 and 202 years, respectively. Structure. Hepativirus A is a picornavirus. It is not enveloped and contains a single-stranded RNA packaged in a protein shell. Only one serotype of the virus has been found, but multiple genotypes exist. Replication cycle. Asterisk humans and vertebrates serve as the natural hosts. Asterisk transmission routes are fecal, oral and blood. Asterisk following ingestion, HAV enters the bloodstream through the epithelium of the oropharynx or intestine. The blood carries the virus to its target, the liver, where it multiplies within hepatocytes and Kupffer cells, liver macrophages. Asterisk viral replication is cytoplasmic. Entry into the host cell is achieved by attachment of the virus to host receptors, which mediates endocytosis. Replication follows the positive stranded RNA virus replication model. Translation takes place by viral initiation. The virus exits the host cell by lysis and viroporins. Virions are secreted into the bile and released in stool. HAV is excreted in large numbers about 11 days prior to the appearance of symptoms or anti-HAV IgM antibodies in the blood. The incubation period is 15 to 50 days and risk of death in those infected is less than 0.5%. Within the liver hepatocytes, the RNA genome is released from the protein coat and is translated by the cell's own ribosomes. Unlike other picornaviruses, This virus requires an intact eukaryote initiating factor 4G, EIF4G, for the initiation of translation. The requirement for this factor results in an inability to shut down host protein synthesis, unlike other picornaviruses. The virus must then inefficiently compete for the cellular translational machinery, which may explain its poor growth in cell culture. Presumably for this reason, the virus has strategically adopted a naturally highly optimized codon usage with respect to that of its cellular host. Precisely how this strategy works is not quite clear yet. Transmission. 1. The virus spreads by the fecal, oral route, and infections often occur in conditions of poor sanitation and overcrowding. 2. Hepatitis A can be transmitted by the parenteral route, but very rarely by blood and blood products. 3. Foodborne outbreaks are common, and ingestion of shellfish cultivated in polluted water is associated with a high risk of infection. 4. About 40% of all acute viral hepatitis is caused by HAV. Infected individuals are infectious prior to onset of symptoms, roughly 10 days following infection. The virus is resistant to detergent, acid, pH 1, solvents, example ether, chloroform, drying, and temperatures up to 60 degrees Celsius. 5. It can survive for months in fresh and salt water. Common source, example water, restaurant, outbreaks are typical. Infection is common in children in developing countries, reaching 100% incidence, but following infection, lifelong immunity results. 6. HAV can be inactivated by chlorine treatment, drinking water, formalin, 0.35%, 37 degrees Celsius, 72 hours, peracetic acid, 2%, 4 hours, beta-propiolactone, 0.25%, 1 hour, and UV radiation, 2 μW/cm2/min. Method of spreading the infection: you can catch the disease by drinking water or eating food that's been contaminated by someone with the virus. You can also get hepatitis A if you eat fruits, vegetables, or other foods handled or prepared by a person who has the virus. Eat raw shellfish harvested from water where the virus lives. Swallow contaminated ice. Have sex with someone who has it. Touch your mouth after touching a contaminated object. Hepatitis A risk factors. You could be at higher risk of getting the disease if you have close contact with someone who's infected. Travel to countries where hepatitis A is common. Are homeless. Use recreational drugs, even without needles. Have a blood clotting disorder like hemophilia. Work with primates. Have HIV. Also at higher risk are men who have sex with men. Kids in childcare and their teachers' diagnosis. 1 IgM antibody is only present in the blood following an acute hepatitis A infection. It is detectable from 1 to 2 weeks after the initial infection and persists for up to 14 weeks. 2. The presence of IgG antibodies in the blood means the acute stage of the illness has passed and the person is immune to further infection. IgG antibodies to HAV are also found in the blood following vaccination, and tests for immunity to the virus are based on the detection of these antibodies. 3. During the acute stage of the infection, the liver enzyme alanine transferase, ALT, is present in the blood at levels much higher than is normal. The enzyme comes from the liver cells damaged by the virus. 4. Hepativirus A is present in the blood, viremia, and feces of infected people up to 2 weeks before clinical illness develops. Hepatitis A treatment. No medication can get rid of the hepatitis A virus once you have it. Your doctor will treat your symptoms. They may call this supportive care until it goes away. They'll also do tests that check how well your liver is working to be sure your body is healing like it should. You can take these steps to make yourself more comfortable. Get some rest. You'll probably feel tired and sick and have less energy than usual. Try to keep food down. The nausea that sometimes comes with hepatitis A can make it tough to eat. It may be easier to snack during the day than to eat full meals. To make sure you get enough nutrients, go for more high-calorie foods and drink fruit juice or milk instead of water. Fluids will also help keep you hydrated if you're throwing up. Avoid alcohol. It's harder for your liver to handle medications and alcohol when you have the virus. Plus, drinking can lead to more liver damage. Tell your doctor about any medications you take, including over-the-counter drugs, as these might also hurt your liver. Hepatitis A complications. The virus usually doesn't cause any long-term problems or complications. Rarely, you may have liver failure or need a transplant. Hepatitis A vaccine. The vaccine to prevent it is about 95% effective in healthy adults and can work for more than 20 years. In children, it's about 85% effective and can last 15 to 20 years. You can take these steps to make yourself more comfortable.